Lumbar spinal stenosis is a common condition in which the spinal cord or spinal nerves become severely flattened by bone or soft tissue and may cause pain or dysfunction in the lower back and legs. The spine consists of numerous bones, muscles, and specialized soft tissues that work together to provide protection, support, and normal function. In patients with spinal stenosis, one or more of these structures fails to work properly, and this results in pinching of nerves. There are two basic types of lumbar spinal stenosis, congenital and acquired. Patients with congenital spinal stenosis are born with spinal vertebrae that are shaped in an abnormal way and result in a smaller than normal spinal canal. Acquired spinal stenosis is more common and is usually due to spinal injury, spinal degeneration, and work-related changes that occur in the spine. Typical symptoms include pain, numbness, and weakness in the lower back and/or legs. Many patients describe a tired-like feeling in the legs, especially after standing or walking. Others describe a tingling feeling or soreness in the back and legs. Most people have improvement in their symptoms with sitting or leaning forward. Most of these patients find comfort in walking slumped forward, leaning over something like a shopping cart. In severe cases, patients may begin to experience increased weakness in specific muscle groups in the legs. A common finding is weakness in the muscles that allow us to lift the toes while walking. This is called foot drop and results in a slapping down while walking and may cause falls. Patients who begin to experience this should be evaluated for possible severe nerve compression or dysfunction. Age-related changes of the spine are the major cause for lumbar spinal stenosis. Back injuries at any stage of life may also negatively affect the way the spine ages over time. Overall, lumbar spinal stenosis usually gets worse and increases as we age. University studies have shown that 60 to 67% of people over the age of 60 have lumbar spinal stenosis. In contrast, only 20 to 24% of patients less than 40 years old have the same disorder. Not all patients will exhibit the typical symptoms. In one study, patients over the age of 60 with no prior complaint of back or leg pain were evaluated with an MRI scan of the lower back. Over 20% of these patients showed positive findings for lumbar spinal stenosis. In fact, many people will see the doctor for the first time with minimal complaints but show very advanced disease on imaging studies. Lumbar spinal stenosis is usually diagnosed by a combination of patient history, examination, and imaging findings. MRI or CT scan are the most reliable imaging studies to demonstrate this problem. However, plain X-ray is also very useful in screening and preparing a specific treatment plan. Examination by a spine professional with special attention to strength, sensation, and reflex changes in the legs is also very important. There are both surgical and non-surgical treatments available for patients who suffer from lumbar spinal stenosis. The treatment plan differs based on imaging studies, symptoms present, and whether or not other treatments have already been attempted. Non-surgical treatment usually consists of a combination of activity changes, oral medications, physical therapy, home exercises, and spinal injections. There are many different types of spinal injections that can be performed at different levels in the spine depending on a patient's main symptoms. Injections of this type are very safe and when performed correctly can result in a significant and lasting improvement in a patient's quality of life. Surgical treatment for lumbar spinal stenosis is usually very successful in patients with symptoms mainly in the legs. The most common surgical procedure involves removal of bone and soft tissue that are pushing on the inflamed nerves. This is known as a lumbar decompression. Depending on additional factors, some patients need this procedure in addition to a spinal fusion. The length of the surgery and your hospital stay will vary depending on the number of spinal levels that need surgical attention. This is generally considered major surgery and carries potential risks that need to be fully discussed with your healthcare providers prior to making this decision. Here at North Oaks, we have a multi-specialized approach to spine care. We are capable of diagnosing and treating patients with a variety of spinal disorders, including lumbar spinal stenosis. This is called the North Oaks Spine Program and includes a complete team of professionals who work together to ensure the best and most appropriate care is being offered to our patients. Team members include spine surgeons, physical medicine and rehabilitation physicians, neurologists, interventional radiologists, and numerous allied health professionals. If you think that you or your family member is suffering from lumbar spinal stenosis, the first step is to be evaluated in our spine program clinic. During this visit, patients are evaluated by either a physician, physician assistant, or nurse practitioner, where we conduct a complete history and detailed physical examination. Then, an individualized treatment or diagnostic plan is developed for each patient to get them on the road to recovery.